All right, welcome back. It is Thursday, and that means the doctor's in the house. In today's Making the Rounds, Michael Holland is here, board-certified family medicine physician with Infirmary Medical Clinic, talking about prostate cancer. And thank you first for stopping by.
Absolutely. Thank you for having me.
We were talking about the main cause of prostate cancer. What are those?
So, Lenise, more than anything, it's going to be your genetic history. If you have a family member, a direct family member, father, grandfather, that has a known diagnosis of prostate cancer, that's something that we want you to tell us, and that's something that puts you at increased risk. Also, I always like to mention that our veteran population that was in Vietnam exposed to Agent Orange, those are people at known risk. So please come and talk to us about that.
Is there a certain age when prostate cancer can happen?
So there's not a definitive age.
Okay.
It can really affect anyone. It is more common in our older men. So it is something that becomes more of a problem or more of a concern that we need to be addressing as you age.
And we all know, genetics can be one of the risk factors, but what are some of the others?
So genetics, as you mentioned, big one, smoking history, environmental exposure history. So people working in industrial plants sometimes have more of an issue with this than others. But those are going to be our primary risk categories.
Okay, and screening. You
Yes.
got to go in.
Yeah, that's right. And that's one of the biggest things that I want our male patients to be aware of is, as your primary care physician, we want to talk to you about this. We want you to be aware of your body. We want you to tell us when symptoms are that you can't really explain what that could be present. We want you to tell us that because we need you to investigate that further. Symptoms like unexplained weight loss, low back pain, changes in urinary habits, frequency, dribbling, things along those lines. Those are not irrelevant. We want to talk to you about that.
And I was doing some reading and saw some information about PSA screenings, and there seems to be some new guidelines on that.
Yeah, so there has been a shift in recent years. Looking back 5-10 years ago, that was a recommendation for every man over the age of 50 is to have your prostate exam and your blood test done, and that would be looking at the PSA, which is prostate specific antigen. As we've kind of looked at that, we've probably over-diagnosed some things or given rise to concern for things inappropriately. So we've backed off a little bit. Anybody that's symptomatic, we are still going to recommend a PSA. Okay. Anybody with the risk factors mentioned earlier, we're still going to recommend that. And then, depending on what we find, we are going to, appropriately get you to the specialist that can help, treat what's going on.
Gotcha. But you can't find out unless you get those screenings. So again,
that's right.
Be aware.
Right.
That's a great message.
Yes.
Thank you.
Of course.
So much.
Thank you for having me.
We're going to have this interview posted for you shortly after this newscast, and that way you can share it with someone you know. Thank you again for stopping by.
Absolutely. Thank you.